Hello, my name is Anakin Fisher. I am an undergraduate research assistant at the Missouri Cancer Registry and Research Center. The objective of this video is to teach physician offices how to report their prostate adenocarcinoma cases to the Missouri Cancer Registry. We will do this electronically using WebPlus. WebPlus is developed by the Centers for Disease Control and Prevention. It is a secure, web-based application designed for use by physician offices and other low-volume cancer reporters that do not have facility-based cancer registrars. The Missouri Cancer Registry is a collaboration between the Missouri Department of Health and Senior Services and the University of Missouri. We are supported by the Centers for Disease Control and Prevention's National Program for Cancer Registries. The Missouri Cancer Registry collects comprehensive data on all diagnosed cancers in Missouri, required by the mandates outlined in Missouri statutes and regulations. The Health Insurance Portability and Accountability Act, known as HIPAA, allows for the reporting of identifiable cancer data to public health entries. Because the MCR falls under the definition of a public health authority, HIPAA allows your facility to report cancer incidence data in compliance with state statutes and regulations. The CDC's National Program of Cancer Registries requires state central registries to collect incident data on residents, follow stringent data management procedures, provide training for state personnel, hospital registry and non-hospital reporting facility staff, conduct case-finding audits at selected facilities, and have legislation in place that mandates reporting of cases by all types of facilities that diagnose and/or treat cancer. The WebPlus login can be found on the Missouri Cancer Registry's website at cancerregistry.missouri.edu. This website contains other resources and information about the Missouri Cancer Registry. On the WebPlus page of our website, there is an overview and a manual to help you with any questions that you may have about WebPlus. Clicking on the WebPlus login button will take you to the WebPlus website. This is a view of what you will see on the WebPlus login page. Once you've logged in, click on Prostate RT below your clinic's name. Use the tabs along the top to navigate within WebPlus. Clicking the Find Open Abstract tab will take you to a list of complete or incomplete abstracts for your facility. The list can be ordered by status, last name, diagnosis date, etc. by clicking on the specific columns. If you ever need to contact us about a specific abstract, please email us with the abstract reference ID number found in the columns circled below. Please remember not to send any private health information by email. Clicking on the New Abstract tab will bring you to this screen where you can begin a new abstract. Please note the session time circled in the top right corner. Press Save circled in the lower left to ensure any progress is not lost. You can always save and come back later through the Find Open Abstract tab. Clicking in each field will bring up a Help text box to the right. Please read these to know exactly what is required in each field. Please note that dates must be entered in the following 8-digit format, beginning with the year, then the month, and then the day. For example, January 1st in 1950 would be written as 1950-0101. As you continue to fill out the fields, use the drop-down menus by clicking on the blue box with the arrow. Choose the appropriate code for each field from the information provided. Some fields have a magnifying glass on the left. Click on this magnifying glass to display a lookup menu for that field. Be sure to fill in all known information. This should include social security number, marital status, tobacco history, and alcohol history. Make sure to document the patient's race. State registries are required by the CDC's National Program for Cancer Registries to record race for all patients. For county of diagnosis, please fill in the 3-digit county code. The Missouri Cancer Registry website has a link that will provide you the correct county from the zip code. You can then look up the 3-digit county code by clicking on the magnifying glass icon to the left of the field. To find the zip code lookup, return to the MCR website. Click on Reporting and then Abstracting Resources from the dropdown. Zip code lookup is on this page. Returning to WebPlus, the date of first contact will be the date the patient was first seen in your facility relating to this diagnosis. Date of diagnosis will be the date of initial diagnosis, whether clinical or microscopically confirmed. It is not the date that the pathology lab returns the results, but the date of the diagnostic procedure. Clicking the calculator icon next to age of diagnosis will calculate the age of the patient on the date of this procedure. Primary site will always be C619 for prostate cancer, and it should already be recorded in the field. In histology ICD-03, it will always be 8140. For behavior, it will be defaulted to 3 for invasive. These text fields are very important. Clicking in each field will bring up a box telling you what we are looking for in each field. Whatever you have coded must be included in text. Race, tumor size, histology, substance history, primary site, and information from the pathology report. Be sure to include dates of all procedures and tests. Remember, write dates in the text boxes for each procedure, test, surgery, or treatment. Be clear and specific about where each surgery or procedure was performed. Text must provide the rationale for selecting the codes assigned to the primary site, histology, extent of disease, and treatment fields. Brief, meaningful comments are all it takes to tell us what we need to know. One way to improve your text is to fill in the text fields first, then code fields in your abstract from that information. While it may feel awkward at first, it will show you how important accurate text fields are to MCR. Enter relevant information to this specific case only. If information is unavailable, state that in the text. Text is evaluated in data quality audits to ensure coding accuracy and completeness. Missing or inadequate text to support the coded fields results in unnecessary errors affecting final statistical results of an audit. Physical examination should include age, sex, race, and information on any past cancers. Be specific. Please note whether there was a digital rectal exam, DRE, and the results. Imaging studies should include X-rays, CT scans, bone scans, etc. We need the date, type of study, and the results. The date does not have to follow the previously mentioned format and can be written normally. PSA lab results should include the date and results of the most recent PSA test prior to the diagnosis. An example would read 12/31/2025 PSA equals 3.5 nanograms per milliliter. In diagnostic procedures, enter the date and name of the procedure used to diagnose the patient. An example would read 1/1/2026, transrectal ultrasound and prostate biopsy. The pathology report information should contain any information from the pathology report. Whatever you have coded previously should match here. Please be sure to include Gleason scores. Staging should include TNM staging from the pathology report or physician note. Surgery should contain information about any surgery a patient may have had related to this cancer. Enter the date and type of procedure performed. An example would be 2/5/2026 radical prostatectomy at ABC Hospital. Radiation treatment must contain the start date and type of radiation treatment received or planned. This includes the specific type of XBRT, brachytherapy, or radioisotopes. Record the targeted sites and the dose in centigrays, as well as the total number of fractions delivered during the first phase of treatment. An example would be IMRT to prostate and seminal vesicles, 8100 centigray in 45 fractions, 180 centigray per fraction, delivered 5/12/26 through 7/12/26. Hormone treatment should include the start date and type of hormone treatment received or planned. An example would be 5/12/26 Eligard injection. All dates should now be written in the 8-digit year, month, day format. Leave these fields blank only when no known date applies. The date of diagnostic procedure should contain the date on which the surgical diagnostic and/or staging procedure was performed, such as the date of a biopsy. The date first treatment began should have the date of initiation of the first treatment for this specific cancer from any facility. This includes the decision of a date to actively monitor or not perform treatment. These are the dates of different treatment modalities. They are used to evaluate whether the treatments were part of first course therapy and to reconstruct the sequence of treatment modes. Date of surgery. This should be the date of the first cancer-directed surgery. In radiation therapy date, record the date on which radiation therapy began. In hormone therapy date, record the date of initiation for hormone therapy that is part of the first course of treatment. In treatment status, select from the drop-down between no treatment given, or active surveillance. The date of last contact should be the last date of any communication with this patient. In cancer status, select the cancer status at the last time of contact from the drop-down. Helpful prompt messages appear to the right for each field when you click in them. These prompts tell you what we are looking for in each field, give examples, and show the format that is required. These are some frequently asked questions. What if a patient has 2 primaries diagnosed? There is only one primary for prostate cancer and only one in that patient's lifetime. How do I fill in the date case completed and date case report exported fields? The software fills in these dates automatically when the case is completed and exported. When would you like the report? Please wait until after the patient has completed treatment at your facility before reporting the case. The plan could change during the course of treatment, so we want to ensure we are recording the actual treatment received by the patient. If a staff member is leaving your facility and a new person will be taking over cancer reporting for your clinic, please notify MCR so we can set them up with a new user account in WebPlus. You can always email Stacy Barr, a certified oncology data specialist with MCR, to ask questions at bars@missouri.edu. Remember HIPAA rules and don't send any identifying information in your emailed questions. We appreciate your timely, detailed, and accurate reporting as we work together to maintain a statewide cancer surveillance system and participate in research in support of the prevention of cancer and the reduction of cancer burden among Missouri residents.